a lot of women are concerned with the stretch marks, the cellulite, obviously the sagging breasts post-surgery. I mean, would you agree with this?
It has definitely become very popular the last few years. It's a subject that I personally feel very passionate about because I think if a woman would like to do that, she should be able to do it. It's not necessarily the fact that because you're a mum, you just have to have, let's say, the marks of the pregnancy on your body. Nowadays, it is safe. And yes, if there are stretch marks or if there is loose skin that can be removed, that's the way to go.
I mean, what is the definition of a mummy makeover? I mean, what does that consist of?
I think, well, I don't know really, but I think that after pregnancy you can have problems with saggy breasts, loss of bulk in the breast, stretch marks. You can have hernias, quite serious hernias, if the baby is very big or if it is a multiple pregnancy. You can have the muscles, the sit-up muscles in the center of your abdomen separate, and this constitutes it's a very serious hernia, and many people, many ladies feel that they're just as bits of fat that they can't remove. It isn't, it's a hernia, and it needs treating, and that means reconstructing the abdominal wall underneath the skin.
Obviously, not everyone is up for cosmetic surgery. There's obviously non-surgical options, I presume, for things like cellulite, stretch marks. Not so much, I would presume, for sagging breasts, etc. I mean, have you got any ideas of what you do to treat your patients on do you do a mixture of non-surgical and surgical procedures?
There are some options for improving certain areas of the body. I have to say that most of the patients that I see are very much into a healthy lifestyle, so they already are on a very healthy diet and they do a lot of exercise and have personal trainers and so on. So there are things that you can improve the circulation, for example, on the legs. So there are garments that you can wear, and there are certain exercise techniques that you can do. There are non-invasive treatments. There's a liposonics treatment, there's a thermals treatment that are applied on the surface of the skin.
Okay.
Unfortunately, if there is loose skin, quite often the only way to get rid of it is by removing it completely. So that does involve a surgical procedure, but it can be a small one, like a mini tummy tuck or just a revision of cesarean scar.
Just want to reference to all of the viewers that obviously there's a lot of procedures to the mummy makeover, post-pregnancy surgery, all on myfacemybody.com. You'll see it on there, all the treatments that both ladies are talking about. Just want to shoot over to some of the footage that we took in Sloane Square, and we got some real insight into what people thought of surgery after pregnancy.
I plan to kind of carry on exercising throughout pregnancy because then it just goes back straight away.
I think if you exercise then after, then it's fine. If you have kids young, then it's fine.
I think it affects some women, but then other women quite like it because it's sort of a representation of what you've been through. So if your body has a scar of you having children, that's a sign of what you've been through.
Sometimes people use the excuse of eating for two all the time through their pregnancy, so just keep an eye on that, and then, you know, you can do kind of stretches and stuff during the pregnancy as well.
I suppose there's cosmetic surgery if you're very, very unhappy with the way one currently looks, but you know, of course there's all these fad diets. There's these diets based on blood type, there's diets based on not eating starch.
After pregnancy you might get obviously loose skin and stuff, things that can't really be helped with exercise. Again, if that was a problem, would you consider that, or would you just be happy with?
I'd be happy how I was. I've done it for the right reasons and had kids.
You know, there's a lot of pressure to look as though, you know, you're young and you haven't had kids. And I think personally that a woman who has born children is beautiful. And that, you know, a body that shows that you've lived is kind of beautiful too.
There was a lot of people that were still anti-surgery, but there was a lot of people that were surprisingly very positive about surgery directly after pregnancy. And I think with, you know, celebrities getting back to their normal bodies quite quickly, it seems surgery does give them a helping hand.
I think that it is important for people to know that when you just had a baby, your hormonal levels are changing, you also have a uterus or a womb which is actually bigger than it normally is. And you need to wait till all that retracts down before you start doing tummy tucks and things like that. Because you can't push it. You need to allow nature to bring you to normality before you start doing major surgery.
So how long would you say, like, you need to
Between
wait?
3 and 6 months, I think.
Okay. Yeah. Okay.
Everybody's different, but the involution or the reduction of the size of the uterus or womb varies between 3 and 6 months, and everyone is different. But you need to balance that.
Yeah, especially for any procedures on the breast, for example. Even though you have stopped breastfeeding, you may still have milk in the breast, so you really have to wait for 6 months. So that's quite important. The celebrities, they have a lot of help.
Of course,
An
yeah.
average mom, especially a mom who has already another child, and you know, it's very difficult to, I think it's completely realistic to think that within a few months you will get back to your normal shape. So I think if you allow even longer, probably a year, because it takes, at the end of the day, it takes 9 months to get there. So it will take you 9 months to get back.